my name is Jordan Dominic. I'm a rising senior at the College of Nursing, and I am on my way to co-op. This is shift 2 so far of the week, and I'm at UCMC on the Burn ICU, and I absolutely love it. So some things I do is she works day shift 3 days a week, and we get report in the morning, and then we go see our patients. We'll do vitals for 8 a.m. and then if it's a burn patient, we have their burn dressing in the morning that we do as nurses, which is kind of cool to do their burn dressing. And then we look at their labs from the night before, if they need any electrolyte replacements, any other antibiotics hung, any other meds essentially. We'll go about our day. And it's kind of cool because we have all kinds of patients on our floor. Like we'll have burns, we'll have like ENT overflow of like flaps of their neck. We'll have some like tibial flaps where they put like the healthy skin and blood flow, and they'll flap it, kind of fold it and flap it over to an unhealthy part where either there was a burn or missing skin from an accident or something. And that's kind of cool. The good thing with co-op too is I've been able to work on my skills so much and do everything the nurse does, and so much more than you wouldn't do in clinical, just because you actually get to do what she does and chart and all this stuff. In my co-op also, some of our patients are intubated, some have A-lines, a lot are on ventilators, in addition to just like burn dressings and severe burns. I've been able to see a bunch of different stuff, and some things I did to help prepare for the co-op application were, if you have a good reputation in clinical, because you submit your eval, you and your preceptor do at the end of each of your semester clinicals, to your co-op application, just being a well-rounded student in the clinical setting as well. I also shadowed some floors over winter break before I applied, and that helped too. Helped me know if I liked their floor and everything, and then also they could see if I was a good fit or not. And then a big thing to do is keep an open mind in the interview. Don't have your heart set on like a limited number of floors or ideas. It's best to keep an open mind for any of the hospitals, any of the floors, because no matter where you're at, it's still a great learning opportunity, and you'll learn so much no matter where you're at. I don't think there's anything else I would add about co-op. It's full-time over the summer and full-time over winter break, and then you'll role transition there, and during the school year it's part-time, so you have to get a few shifts a month, and it's not bad. They are 12-hour shifts, and I've really enjoyed it. And even from May to July now, I've learned so much. Completely different person, more confident in my skills and myself, and just more comfortable in the patient setting as a nurse. I cannot wait for you guys to have your co-op eventually and see how far you come.